Humanitarian groups in Cameroon are visiting homes and villages in remote areas this week to mark Breast Cancer Awareness Month, advising women to go to hospitals for free screening and treatment. About 60% of the more than 7,000 women diagnosed with breast cancer in Cameroon this year have died because they were late in getting to hospitals, officials say. Breast cancer deaths are highly unreported because families abandon women to die at home. 30-year-old history student Emily Nadege Atangana told a group of women and girls at the University of Yaoundé one campus how she was psychologically and emotionally traumatized after receiving a diagnosis of breast cancer in 2020. Most of her relatives, friends, and fellow students said she would not live long and abandoned her, she said. Atangana said she found hope when medical staff members of the Yaoundé Gynecology, Obstetrics, and Pediatrics Hospital told her that 90% of early-stage breast cancers are curable. Cameroonian government officials and humanitarian groups say cancer survivors such as Atangana have been sent to towns and villages as part of activities marking Pink Month. The World Health Organization designates October as Pink Month, a time to teach people about cancer, including early identification and signs and symptoms. 42-year-old Masode Ngwiz Agba, a cancer survivor, said people should stop hiding cancer patients at home to die because of the false belief that cancer cannot be treated. You don't need to hide alone with your pain, she said. Share it with somebody, and the people will be ready to help you. I was operated on, and after the operation, I have been following treatment until now. I am fine. This year's theme for the month in Cameroon is No One Should Face Breast Cancer Alone, and yes, no one is expected to fight breast cancer alone. Ruth Amin, a public health specialist and project manager at the Yaoundé-based Lafafa Research Foundation, said that sending people suspected of having breast cancer to hospitals would prevent many of the deaths caused because the women were abandoned or got to a hospital too late. We are calling on the men to support their spouses, to support their mothers, to support their sisters in raising awareness, in carrying them to the hospitals to be clinically examined by professionals, she said. Women should speak up, she said. Women should go toward the health facilities to get examined because the earlier they are being diagnosed, the easier it would be for them to be treated. Amin spoke to VOA via a messaging app from Bia, a southern commercial city where humanitarian caravans were educating residents about breast cancer on Saturday. Cameroon says it has equipped all hospitals with qualified medical staff members and equipment to diagnose breast cancer. The World Health Organization estimates that Cameroon has about 20,000 new cancer cases, including breast cancers, each year, with 65% related deaths.